I had this dream. I wanted to become a doctor at age 6. There was no medical school in Sierra Leone then. And if you want to be a doctor, you have to get a scholarship to go to Russia or Germany or the UK. And you also have to have high connection at the government, or your parents have money to send you abroad. My father is a village tailor who earns less than a cent a day. So I dropped that dream because of that. But then when I heard that they've opened a medical school in the country, it ignited my dream. I was like, wow, now I can become a doctor because I'll be able to study here in Sierra Leone. I took the exams and I passed. I had high grades in the country and I had got a scholarship to go to medical school. In 2006, when I had just finished medical school and I was working in a Catholic hospital, I met this American medical student, Dan Kelly, who went to Sierra Leone. And he was wondering why you have all these amputated, disabled people on the streets of the capital. I told them that Sierra Leone had a 10-year civil war, which started in 1992.
A lone rebel sniper brought the forces under fire. The civilians huddled together for protection.
The rebels will start recruiting young child soldiers who have machetes. They would actually chop your hand and give you a note, say, go to President Kaba and tell him that it's because you have arms, that's why you voted. And if you didn't have arms, you will not vote. The war was known for the high number of intentional amputation. After the war, after the emergency phase, most NGOs wrapped up and they left the country. And so you have thousands of amputees in amputee camps across the country receiving no medical care. We decided to start a non-profit called Well Body Alliance to provide high-quality care. And so we started serving the amputees in Kono. Kono is the diamond-rich district, and Kono district was the most destroyed during the war. There's actually no healthcare in Kono. I would see like 200, 300 patients in 2 days. So our mission shifted to helping strengthen the healthcare system. I'm interested more in being able to link the social problems to the medical problems and understanding the social context of a disease. I got a Fulbright scholarship to do my master's with Harvard in global health delivery. And I went back to Sierra Leone in June to do my thesis research. And then Ebola struck. Ebola is a virus that actually is transmitted from close direct contact of bodily fluids from someone who is infected from Ebola. It's very infectious when the person dies because the virus tries to leave the body. So fluids from a dead person is highly concentrated with the Ebola virus than even the live human. The most common symptoms of Ebola is fever, diarrhea, vomiting. And then late symptoms includes then the bleeding from all your orifices. We've seen Ebola outbreaks around the world for the past 20, 30 years, but this is the first one that you have a whole country, all districts in the country get infected. And it just tells to the fact that with a very weak healthcare system, an epidemic like this would really escalate. And then in July 2014, Harvard sent an email out to all students that are in Sierra Leone, Liberia, and Guinea, saying to return to Harvard. So I had to stop my research and I was evacuated with my family. But I remember the day at the airport, I was in this dilemma, like, this is an opportunity to get my family out of this country, but I really want to be in Sierra Leone as a clinician and I want to help with Ebola. So then I resolved saying that, okay, I'll take my family out, but I'll come back. The moment I landed at JFK, the first thing I wanted is to leave, to go back. But I spoke to my wife. She was like, "You're going back and you're taking that risk. If something happens to you, like, where would your wife and kids, what will happen?" But my son would tell his mom, like, "Oh, leave him to go. He's going to save lives." And so I came back. So for the past 3-4 months, I've been directing the community health workers program for the Ebola. In a developed country, you have people who care for the dead. You have a dead family, somebody who come take them to a funeral home, take care of them. You don't have that in countries like Sierra Leone. So people just have to bury their dead the way they're able to bury them. And imagine if the dead person in a remote village like 20, 30 miles away, and you call the hotline, the ambulance takes like a day or two to get there. What would you do? Because there is no way you can say, "I will not touch my mom" when she's sick. She's laying in her bed, vomiting. I call the hotline. It will take 3 days for them to come. I cannot leave my mom on her vomitors for 2 days. So basically what we try to do is to engage the community and ask them, what would you want to do if you're a dead one? Like, you have a dead person. You know, if you touch them, you would get infected. So what would you do? We started what we call interim care. The idea is you provide gloves, like a plastic apron, chlorine, basic things for one family member, and say, okay, well, while waiting for the ambulance, you're trained, this is how you wear this apron, this is how you wear your gloves, this is how you remove them. So you will be taking care of your loved one while you're waiting for the ambulance. During the war, my father died, and then my mom was captured by the rebels. I mean, having lived through poverty, having lived through all this kind of stress, makes me understand when somebody tells me that he's hungry. I know what it means. And if somebody tells me they lost their mom and dad, I understand what it really feels like. So I think that's why I am dedicated to serving these poor people.